representing Debt Counselling Group South Africa, and also a representative of the Debt Counsellors Association of South Africa, aka DCGsa, here to discuss the recently signed National Health Insurance Bill and how it affects over-indebted individuals and medical aid subscribers. This should be a fascinating chat. Casper, welcome. How are you doing? Are you well? Always a pleasure having you in studio.
I'm always blessed, Mr. K, and it's nice to see your vibrant smile. You always bring that smile out when you talk, and one can hear it on air, eh?
I love it. Glad. All right, Casper, let's get into it, man. It's been a week or so, nearly a week since the announcement of this NHI Bill being passed, written into law, signed into law. Now, the bill aims to transform South Africa's healthcare system. Can you give us an overview of what this means for ordinary individuals, especially those who are struggling with debt?
Wow, that's a mouthful, eh? That is it. It is something scary. The unknown is always scary. And we must look at it now from both sides.
Yeah.
From the implementation from government side, and from how we as the public and the consumer need to deal with it and all our fears. So what is the bill designated or designed for? Well, it is there to provide universal health coverage.
Yeah.
So to cover everybody. To make sure the poor is covered, the rich is covered, everybody is covered, which means that all South Africans will have access to comprehensive health services without significant out-of-pocket expenses. This is particularly beneficial for the over-indebted individuals. So if you are struggling and you can't really afford healthcare services, and it's not covered by your medical aids, then the NHI sounds like a really good idea, good thing, and I'm excited as a consumer, from a consumer that's over-indebted. This is something that might excite me. And maybe you're sitting at home and say, wow, medical bills are too high, I can't afford it. Wow, I can't wait for this to be implemented, and I can eventually sort out that aching tooth that I can't afford to fix.
Now, it sounds like a significant change, Casper, but how does the NHI plan to eliminate these out-of-pocket expenses?
Oh, well, here's where it starts to get tricky and the questions start arising. So the NHI will eliminate co-payments and user fees for covered services. So if it's covered, you don't have to have co-payments, there's no user fees, but this means that healthcare services will be delivered free of charge at the point of service. For those currently facing additional costs for medical care, this could provide substantial financial relief. So if you're there in the middle class and you're really struggling, you can't afford the extra payments. I've got medical aid, but that added on things that always just gets added onto that bill because I want decent service. Services will now be covered.
All right, fantastic. What about access to quality healthcare? It's always an issue, this one, a long-standing issue. Will NHI improve this? Please tell me the answer is yes.
Well, we're hoping the answer is yes. So that's one of the key goals of the NHI. Well, their hopes and dreams is that the NHI is to ensure equitable access to quality healthcare. So that's one of their goals. It aims to bridge the gap between the private and the public healthcare. So we know there is an issue, and we know there's an issue in public healthcare. The question naturally that arises here: will government be able to bridge that gap realistically? Yes, we can all have our hopes and dreams, and yes, in their goals is that it would do that to ensure that all South Africans receive high quality service from both public and private providers. Because I think all of our fears is, the queues are going to be at Life Healthcare, and the guys that is paying needs to go to Frey, and, the services might not be as good. So this is there to make sure FREIR is on the same standard as life. If it will get there, time will tell. But the NHI promises a comprehensive benefit package that includes a wider range of healthcare services than many current medical schemes offer. So hopefully it covers everything. And that's what we're hoping for.
Yeah, absolutely. Now, financial relief sounds fantastic. It really sounds great. But how will the NHI affect overall healthcare costs?
Well, by consolidating resources into a single fund, the NHI aims to reduce overall healthcare costs so that some private guys can't run away with costs if they've got the monopoly in the market.
Yeah.
And we can then negotiate pricing and bulk purchasing of services and products, so we can go bulk purchase this and naturally supposed to make it cheaper. And this could significantly lower the cost of health care for over-indebted individuals who currently spend a large portion of their income on medical aid premiums, especially when you've got monthly expenditure, now the word has gone off of my head, your prescription medication, not your prescription medication, but your chronic medication, that's not always covered, or some of it's covered, and by September your savings runs out. And hopefully this will stop that from happening, and that you get your monthly things and you don't run out of medical aid, and when you are sick and you need your medical aid, this will then hopefully cover you still in October, November, those months that people don't have the funds.
Yeah, usually runs out by then, unfortunately. All right, then here comes the big question, Casper. How will the NHI be funded? We had a big discussion about this one off air. Casper, talk to us.
So I must answer what is put to us.
What do the experts say?
We're not going to go to where the experts saying, but let's answer it from where it's supposed to come. So funding for the NHI will come from general taxes.
Okay.
Payroll taxes and surcharges on taxable income. This means that healthcare costs will be more evenly distributed across the population, potentially reducing the financial burden on individuals.
That sounds phenomenal.
But
where? I knew there's a but.
But where? So, where is this? Because this is really a significant burden on us as South Africans, especially if you earn an income. And I think this is where government really needs to tread very carefully, and where the experts and the medical aids are coming in and saying, listen, what is this going to cost us? Because if you start doing the sums, it's scary amounts. It's got a lot of zeros. And I don't think we're covering currently those zeros. Well, the experts are telling me we're not covering all those zeros. So somewhere the money needs to come from. Is it going to be from added VAT? Is it going to, yes, they're saying general taxes, they're saying payroll taxes. So how is it going to be payroll taxes? What about somebody that doesn't earn a salary, self-employed?
Yeah.
How is that going to work? So these are all things in the short term that government still needs to figure out. So I don't see this happening very soon, and we need to give all those answers. And I'm sure there's going to be a lot of legal action left, right, and center to try and get the answers.
Let's talk about the medical aid subscribers there.
Aid subscribers, in the long term, medical schemes will only be allowed to cover services not provided by the NHI. However, the transition will take at least a decade. So a minimum of a decade, so it's not overnight. So for now, existing medical aid coverage will remain unchanged. Your medical aid will still be your medical aid. Private healthcare providers will still operate, but will need to comply with the NHI regulations regarding pricing and services. So that last part for me is really positive. But the scary thing is the long term, where is it going to end up? but not soon. We're not going to see changes very soon. First step is going to take at least 3 years. So let's see.
Are there any potential challenges? I'm sure there are, to the implementation of the NHI. I think we've mentioned at least two of them so far.
Yes, definitely. Well, there is definitely potential of legal and structural challenges. So, like everything, you need to ask the question, is this really viable? We all, there's lots of great ideas formed in our wonderful rainbow nations. But critics argue that the NHI might face legal challenges due to concerns about its feasibility, funding, and the impact on the private sector. You can't take the private sector. We've got a very strong private sector in banking, in the whole financial industry.
Yeah.
And unfortunately, we've seen the government structures unfortunately fail on multiple levels. We've seen Eskom, we've seen Transnet, we've seen the post office. So do we really want to get rid of the private sector? I don't know if that's the answer. Maybe the NHI is a great goal to have, a good aim, but I think in its current form there's a lot of critics, and rightfully so. I think the experts need to get involved, but also, NHI aims to reduce healthcare costs for individuals. It could increase the tax burden. Can we afford it? I don't know. Particularly on the middle income earners. And I think we discussed that, Mr. K. Currently, our middle income earners can't afford more. They are very overburdened with debt. 79% of their debt their income goes towards debt already. How are they going to afford this NHI? Are we going to kill our middle class completely? Are we going to only have extremely wealthy and extremely poor people left? And is the extremely wealthy people going to stay? So we need to be very mindful. And then the natural question, and I'm running completely off your question, but if we look at 2019, we had debt intervention. That's still not implemented.
Yeah.
It was signed by the president, but it was clearly a political ploy. And I'm saying this on air and live on Facebook, but it was clearly a political ploy. Now the question remains, just before elections, is this another big thing to hype up the masses for votes? Is this something we can afford? But we must tread very carefully, especially our political people, our government structures. We must take care of not only the poorest of the poor, but our middle class is in dire need of assistance. And I don't think it must fall on deaf ears. The government must start listening to those calls and pleas from the middle and high-end consumers as well.
Absolutely. Casper, thank you so much for this insightful discussion. It seems this NHI bill represents a significant shift towards universal healthcare in South Africa, which is, of course, a good thing with many potential benefits, but also challenges that do need to be addressed. Of course.
100%, Mr. Gain, thank you. But it's important that we as consumers and we as listeners to Link FM and we as individuals and South Africans must keep ourselves informed with these discussions. And we must know about these changes and educate us on these changes, because at the end of the day it impacts our financial decisions and our healthcare situations. So educate yourself and learn more about it. And I want to refer the listeners to the financial scripture for this week. Command them to do good, to be rich in good deeds, and to be generous and willing to share. Something to dwell on from 1 Timothy 6 verse 18. So before we just make our life decisions and raise our opinions, which we are so good to do as South Africans, go back to 1 Timothy 6 verse 18. Command them to do good, to be rich in good deeds, and to be generous and willing to share. So maybe we must look at a way to maybe make this work. But I don't know in its current form. According to the smarter people out there that knows more, there's still a lot of challenges. Maybe it's got a good idea, so let's help shape that good idea.
All right. Casper, thank you so much for coming through. I really appreciate having you on as always. But of course, cannot leave without sharing those also important contact details. I can't believe you forgot, Casper.
I never forgot. You know I want to put you on the spot, like Casper. I always do. Can you recite that number out of your head?
Well, of course I can. It is 086 100 1047. Thank you very much, Casper.
And I want to encourage the listeners, if you listen today and you find it insightful, please go to DCGsa's Facebook page, dcg.South Africa on Facebook, and go share. Our videos are all there. Our Monday Matters live streams are all there. Go share it with that family member or friend that has comments, or maybe they're in a predicament. Maybe they're struggling with their medical aid bills or their medical bills that wasn't covered by medical aid, and they need some budgeting assistance. So get in touch, or go to our website, www.dcgsa.co.za. Click to call, click to WhatsApp, and be encouraging and helpful to one another. Spend a little bit extra time. You'll be surprised how many people just need an ear to listen. And maybe you can help an individual or a family friend. Have a blessed day, Mr. K.
Fantastic, Casper. See you next week.